Hey guys, today we're going to talk about a very common orthopedic condition that we see in the clinic called carpal tunnel syndrome. Carpal tunnel syndrome affects 15 to 20% of people in their lifetime. We're seeing this become even more prevalent as our world becomes more and more technologically based, with folks kind of sitting at a computer desk and typing for work. Carpal tunnel syndrome refers to compression of the median nerve as it goes underneath the carpal tunnel. The carpal tunnel refers to this region of the wrist, or the palmar aspect of the wrist, where we have 9 flexor tendons in the median nerve. There's a band of connective tissue that goes over top of these, kind of keeping all of those flexor muscles in place so that when we flex our wrist, the tendons don't kind of bulge out. So carpal tunnel syndrome starts when we have compression of that median nerve in that space. Typically, the first symptoms that we're going to see are tingling in the thumb, the pointer finger, and the middle finger. And this usually all happens on the palmar aspect of the hand. Occasionally, you'll see a little bit on the tips of the fingers on the dorsal aspect or the back of the hand, but usually it's just on the palmar aspect of the hand. As the pathology kind of progresses, you might start to see some numbness, some pain, and ultimately some muscle wasting and some loss of coordination. Typically, you don't start to see that muscle wasting and the loss of coordination until the later stages of carpal tunnel. It usually starts with that tingling to pain to numbness. Oftentimes, we see those symptoms are worse first thing in the morning after sustaining prolonged positions at night, and we see those symptoms are worse throughout the workday, or if we're doing something with like repetitive movements such as typing or working with your hands at work. Some of the most common causes of carpal tunnel syndrome include overuse, right? So prolonged positions at work. Posture plays a major role in carpal tunnel syndrome. So we've already discussed that it affects that median nerve. So the median nerve starts in the cervical spine as the brachial plexus forms, and it goes down the entire length of the arm into the hand. So if we are sitting kind of with our shoulders rounded in a poor posture at the neck and shoulders, we are furthering the compression of that median nerve all the way down the upper extremity. So posture is hugely important to rehabbing carpal tunnel syndrome. We also can see some systemic causes of carpal tunnel syndrome, including things such as diabetes, rheumatoid arthritis, and pregnancy, right? So in pregnancy, we hold on to a little bit of extra fluid, which can further the compression in that carpal tunnel space. With something like diabetes or rheumatoid arthritis, we might see a little extra sensitivity to nerve irritation. So those can kind of put us at risk for heightened symptoms with carpal tunnel syndrome. Physical therapy is extremely effective for mild and moderate cases of carpal tunnel syndrome. Oftentimes, we're working on posture, strengthening the wrist extensors, and improving the extensibility of the muscles in that carpal tunnel space. We also have some other modalities that we can use at our disposal to improve your symptoms with carpal tunnel syndrome. These include night splinting, or putting something on the wrist so that keeps you out of a compressive state at night. Additionally, if we are in some of those later stages of carpal tunnel syndrome, you might use some more invasive measures such as like a corticosteroid injection. And if we are in some of the really kind of outlier extreme buckets of carpal tunnel syndrome, oftentimes a surgery might be indicated to give you a little bit of extra space in that carpal tunnel. So if this kind of sounds like you, if it sounds like we have carpal tunnel syndrome affecting you currently, cycle through our regimens. They're really effective for folks in that kind of mild to moderate bucket of carpal tunnel syndrome, and see if we can get you some relief and kind of cycle through those to kind of see if we can start that rehab journey. This is the median nerve glide. You're going to take the affected upper extremity, and what you're going to do is you're going to extend the elbow and then slow and controlled extend the wrist. While you're doing that, I'm looking down at the hand that's extending. I'm going to hold for a second, then I'm going to flex my elbow and look away. So I'm extending the elbow first, then the wrist and hand. As I look down at my hand, I'm going to flex my elbow and look back. If we do this right, you should feel a nice stretch along the area where you're feeling discomfort. So right now I'm feeling a stretch in my thumb and in my pointer finger, and then I'm coming out of the position. This is a great exercise to do while you're at work or while you're experiencing symptoms. Great exercise to do right before bed or first thing in the morning, just to kind of desensitize that nerve root, desensitize that median nerve. Back. So it's a slow and controlled movement. And you can play with the angle a little bit to see if, so everybody's symptoms are a little bit different. You can play with at the angle of your arm a little bit to see what you need to kind of find what seems to reproduce your symptoms. But a typical set and rep scheme here is 2 to 3 sets, about 10 repetitions. Again, this is one you can kind of just sprinkle in your day however you see fit. So whenever you're at work, if you're driving in the car, at a red light, things like that, to kind of sprinkle in a little bit of mobility along that nerve distribution. Again, this is the median nerve glide. This is the wrist extension stretch. What you're going to do is you're going to take one hand and you're going to grip onto the opposite forefingers, keeping your thumb extended, so making sure your thumb doesn't flex in. You're going to straighten out the elbow and pull the hand back until you feel a pretty good stretch in the wrist flexor muscles. So you should feel this all in that palmar aspect of the forearm. You're going to hold it for about 30 seconds and then give yourself a little bit of a break. Making sure you're not pulling into pain, so kind of find what your comfort zone is here. You're not trying to push past any pain barriers, but find about a moderate intensity stretch. So again, I'm taking one hand, I'm gripping onto those forefingers, keeping my thumb straight, and I'm pulling straight back to find a nice stretch in those wrist flexor muscles. These are the muscles that run right through that carpal tunnel to get a little extra extensibility through that region. Okay. 2 to 3 sets of about 30 seconds should be sufficient here throughout your day. This is the wrist flexion stretch. So we're going to be stretching all of the muscles on the back side of the forearm to add a little extra mobility through the wrist, so that when we move our wrist, it's going to allow some better sliding and gliding through that carpal tunnel. You're going to take one hand and you're going to go over top of the opposite side hand and pull straight down, keeping your elbow straight. You should feel a nice stretch along the top aspect of your forearm or the dorsal aspect of your forearm. And you're going to hold it for about 30 seconds, trying to find about a medium intensity here. So with this kind of stretch, as we go into wrist flexion, if it's irritating your carpal tunnel syndromes, reduce the range of motion a little bit. So if you're kind of pulling your wrist down like this seems to cause some of that tingling, just take a little bit off of the range and see if you can still kind of hold that position for about 30 seconds, going for about 2 to 3 rounds of 30 seconds throughout your day, the wrist flexor stretch. This next exercise is called the tallow ring out. So you can either use a TheraBar or you can use an actual towel. The TheraBar gives you a little bit of an option for different types of resistance that makes it a little bit smoother for you. But if you don't have one yet, you can use a towel in a pinch. So what you're going to do is you're going to start with both palms facing down on your TheraBar. One wrist is going to curl down as the other wrist curls up. Pause for a second at the end range and then kind of unwind it. Regrip, one wrist curls down, the opposite wrist goes up as if you're trying to wring out a towel, and then back. Okay, so each time you're kind of regripping. So we'll go 10 repetitions on one side and then 10 repetitions on the other side. So each hand gets a chance to flex, each hand gets a chance to extend. A good set and rep scheme here is about 2 to 3 rounds, about 10 to 12 repetitions. If we do it right, the arms should feel like they've got some work in at the end of these 2 to 3 sets. Okay, 2 to 3 sets, about 10 to 12 repetitions. From the side, it's going to look like this. So my right wrist will be extending here. So my right wrist extends as my left wrist flexes. So a couple rounds of that looks like this. And then we'll kind of switch it up. So now I'm going to go into right wrist flexion and left wrist extension. Okay, that looks like this. By the end of 2 to 3 rounds, we should be feeling the fatigue, feeling the burn. Okay, that's the towel ring out using either the TheraBar or you can use a towel. This is the banded scapular retraction. So you're going to grab a light to moderate band here. You're going to tuck your elbows at your side. You're going to squeeze your shoulder blades back and open up your arms. So we kind of talked about how posture was so important for carpal tunnel syndrome. And this is going to work on some of the up the chain issues that we see kind of help to cause carpal tunnel syndrome. Good set and rep scheme here is 2 to 3 rounds of about 10 to 12 repetitions. If you're at the office, if you're at work and you don't have your band with you, you can still do this exercise without the band. We might just get a little extra out of it with some resistance. Okay, so this is a good exercise to do with resistance to build up capacity in those muscles, to build up strength in those muscles. Or if you're just trying to kind of get out of a flexed posture position because it's been a couple hours at work or you've been driving the car for a while, you can do this one just with body weight. Okay? About 2 to 3 rounds, 10 to 12 repetitions. This is the scapular retraction, really making sure to squeeze those shoulder blades back in the backside. So pinching those shoulder blades back.